afternoon. I'm Asia Johnson, and you're watching CHI Daily News. On today's segment, we'll be discussing health disparities and their relationship with the four ethical lenses and cultural competence. The Affordable Care Act, which we all know as being the highlight of President Obama's administration, under the ACA, there's no room for health disparities. So everything it is works to eliminate them. Health disparities can be defined as anything that expresses itself as a discrepancy in the quality of, access to, or the outcome of healthcare among socially disadvantaged groups. With its goals, provisions, and the individual mandate, the ACA has made healthcare more accessible to all American citizens, and although there are still issues to be fixed, and some do not agree with that, there is no denying the impact it has made overall.
Medical advances and new technologies have provided people in America with the potential for longer, healthier lives more than ever before. However, persistent and well-documented health disparities exist between different racial and ethnic populations. Health equity remains vague. Health disparities or differences in health outcomes are closely linked with social, economic, and environmental disadvantages, are often driven by the social conditions in which individuals live, learn, work, and play. Overwhelming evidence shows that the racial and ethnic minorities are prone to poorer quality health care than white Americans, even when factors such as insurance status are controlled. As the nation's population continues to grow and diversify, the healthcare system will have to change and adjust to meet needs of an increasing multicultural patient base. All people should have the same opportunity to reach their full potential of health, yet those who live and work in low socioeconomic status circumstances, which include racial and ethnic minorities, often experience reduced access to healthy lifestyle options and suffer higher rates of morbidity and mortality compared to the higher income counterparts. So how can we improve our healthcare system regarding these disparities? Well, the Affordable Care Act, which is a landmark signed by President Obama that has brought insurance coverage to millions of Americans, including racial and ethnic minorities. The Affordable Care Act not only includes provisions related broadly to health care insurance coverage, health insurance reform, and access to care, but also provisions and preventions which directly affect minority communities. The Affordable Care Act also reduces health disparities by investing in the prevention and wellness and giving individuals and families more control over their own care. The bill provides additional details on the provisions that will affect health disparities, two of which are important initiative mandates by the Affordable Care Act. They are National Strategy for Quality Improvement in Healthcare, which include priorities to improvise the delivery of healthcare, and the National Prevention of Health Promotion Strategy, which aims to bring prevention and wellness to the forefront of national policy. In addition to the ACA, there are more possible options to explore to try and help the racial and ethnic disparities that are present in the U.S. As our society increasingly becomes racially and ethnically diverse, physicians and other healthcare professionals need to acknowledge the cultural information and linguistic needs of their patients. Health literacy among racial and ethnic minorities must be strengthened in a culturally sensitive manner. Other options to explore is that physicians and other healthcare professionals must be sensitive to cultural diversity among patients and recognize that preconceived perceptions of minority patients may play a role in their treatment and contribute to disparities in healthcare among racial and ethnic minorities. Such initiations as cultural competence training should be incorporated into medical school curriculum to improve cultural awareness and sensitivity. Another necessary option is that the healthcare delivery system must be reformed to ensure that patient-centered medical care is easily accessible to racial and ethnic minorities. Lastly, a diverse healthcare workforce that is more representative of those they serve is crucial to promote understanding among healthcare providers, patients, facilitate quality care, and promote equity in the healthcare system. To make that happen, though, some steps need to be made, such as the education of minority students at all education levels, especially in the fields of math and science, need to be strengthened and enhanced to create a larger pool of qualified minority applicants for medical school. Secondly, medical and other health professional schools should revive efforts to improve enrollment and graduation rates of minority students. American College of Physicians already supports policies that allow institutions of higher education to consider a person's race and ethnicity as a factor in determining admission. Also, medical schools need to increase the efforts to recruit and retain minority faculty. Efforts should be made to hire and promote minorities in leadership positions in all areas of the healthcare workforce. And lastly, funding should be continued and increased for programs and initiatives that work to increase the number of physicians and other healthcare professionals in the minority communities.
Next, we have Preston Higgins here to talk to us about cultural competence versus cultural humility. Cultural competence is having knowledge of other cultures and understanding the behaviors and attitudes of the people within that said culture. Cultural humility, on the other hand, is all about being open to understand cultural identity and what is most important to the persons within that group. The difference between the two is one is self-oriented and focuses on, I know this about you, and the other is person-oriented and instead announces, I would like to understand your culture from your perspective. Both concepts are important to improving the quality of healthcare, although one is a bit more progressive than the other.
Thanks, Asia, for that introduction. First, the term cultural competence emerged in the United States in the 1980s. This was due to the need for providers, health, as well as education to meet a better standard as multicultural populations arise through our communities. However, there is no universally accepted definition of cultural competence, but many definitions share key elements like valuing diversity, being able to self-assess one's culture, and being conscious of dynamics essential to cross-cultural interactions. Cultural competence can be used to improve access and equity, as well as a business strategy to enhance cost effectiveness. In healthcare, there are different levels associated with cultural competence. For instance, at an organization level versus at an individual level. At an organization level, a plan is set into place to support efforts of individuals like policymaking. This could help eliminate discrimination. At the individual level, cultural competence may include the ability to identify one's own cultural assumptions. It includes being able to empathize with patients and to obtain connected knowledge, recognizing the worldview from another's eyes, or being able to see others who view the world through a different cultural lens. On the other hand, there is a cultural humility which involves being open to other cultural views. This process is lifelong and is essential when involved with doctor-patient relationships. Being humble, having a respectful attitude towards individuals creates them to challenge their own cultural biases, recognizing that they cannot primarily know everything about another's culture. Overall, cultural competence and cultural humility play a vital role in healthcare and efforts to improve doctor-patient relationships, reducing biases that create health disparities.
Now we'll hear from Jarrell Long on the 4 ethical lenses. The Ethical Lens Inventory is a personal evaluation tool designed to help students understand the value that influences their choices. It identifies how they prioritize values when making ethical decisions. The goal of the ethical lens is to help you distinguish what is right and wrong based on your own standards. Understanding ethics will increase your emotional intelligence and makes decision-making a smoother process.
All right, hello viewers. Today we're going to be discussing what is ethics and what lens do you fall under as a viewer. Okay, first off, what is ethics? Ethics is what makes a good person or what a good person is supposed to be in someone else's eyes. Your family and community help shape a person and your personal ethic code. It also determines what ethical lens that you fall under. The first lens that we're going to talk about today is the relationship lens. In the relationship lens, key phrases and values that people tend to say are that I am fair and I am just. Some justifications for the actions people may come up with in the relationship lens is I make sure that everyone is treated fair, and of course, I am fair. Alright, some gifts that people have that are in the relationship lens that they seek justice and fairness when making decisions. They act in concern for the least advantaged, and they celebrate healthy intuitions. Alright, the second lens we're going to talk about today is the reputation lens. In the reputation lens, people tend to make choices to say that I make virtuous choices, I am fortitude, and I am compassionate and responsible. Some things that people may say to justify their actions under the reputation lens is The decision that I made was hard, but I had to make the decision because I'm the leader. And I always want what's best for all. Some gifts that people have under the reputation lens is they seek wisdom, they act for principles of leadership, and they celebrate moral courage. The third lens is the rights and responsibility lens. The rights and responsibility lens, people tend to say, I am responsible, I am honest. To justify their actions, people tend to say, I do my duty and I follow the rules. Some gifts that people have under the rights and responsibility lens is they seek self-knowledge, they act for guidance and principles, and they celebrate being accountable. The fourth lens that we're going to talk about is the results lens. People in the results lens tend to believe that they make choices that are good for everyone, and they respect for self and others are above the chart. Justification, they believe that I make people happy and I'm respectful to all. Some gifts that people have that's on the results lens is they act well, they act from free will, and they celebrate creative change. And those are the lenses. Which lens do you fall upon?
Now we'll hear from Carly Bright with a summary of today's segment.
Cultural competence is used for providers' health as well as education to meet a better standard as multicultural populations emerge through our communities. There is no universal accepted definition of cultural competence, but many definitions share key elements like valuing diversity, being able to self-assess one's culture, and being conscious to dynamics essential to cross-cultural interactions. At the individual level, cultural competence may include the ability to identify one's own culture assumptions. It includes being able to empathize with patients to recognize the worldview from another eye. Cultural humility involves being open to other cultural views and is essential with involved in doctor-patient relationships. Overall, it plays a vital role in healthcare in efforts to improve relationships, reducing biases that create health disparities. These relationships are based on one's ethical code and conduct. As a review, ethics are moral principles that govern a person's behavior or the conducting of an activity. Individuals, family, friends, community, and environment are what influence our ethical codes, which help shape our ethical lens. There are 4 ethical lenses. These lenses include the rights and responsibility lens, which consists of being honest and responsible, results lens, which is having respect for self and others, relationship lens, being just and fair, and lastly, the reputation lens, which portrays the actions of a leader. And this concludes the summary of our discussion. Thank you all for joining us today for the discussion on the issues of racial and ethnic disparities and the impact they have on healthcare.